Recording has begun.
Hello, my name's Kyle. I'm from the ePMA team, and I've been asked to create a short video for you to watch just to help explain ePMA a bit further. Some common errors that we've seen in the past, some tips and tricks, really, so you can get the most out of the system. So I wanted to start by just letting you know ePMA is live in Lincoln, Boston, and Grantham. We're live in ED at Lincoln and ED at Boston, and we are live in theatres, all three sites. A couple of areas we aren't currently in is ICU, maternity, or pediatrics. Those areas are still on paper. Okay. I wanted to show you our intranet page. So if you access the Trust Intranet and go to A to Z under D for digital learning, uh, there is a page that has all the sort of clinical systems and their web pages. If you go down to E, there's an ePMA. This is also how you access the e-learning. Okay, so we'll click on the prescribers, e-learning link at the top. Please all have a look at it. It's much more in depth than what I'm going to show you today. It is really useful. But on this web page, you've got pocket guides, you've got how-to guides, and at the bottom, you've got very short 1-2 minute videos that have sort of been taken out of the e-learning. So any questions you have about the system while you're using it, it's very likely the answer will be on this web page. Okay, so please make yourself familiar with it. If we have new training material, we do add it on here. Okay. So I'm going to go to the system. This is a prescribing profile. You can see I'm currently logged in, so please don't share logins or use a colleague's login if they've left it on. This is test ward with fictional patients. So I'm going to choose my patient. If you are on a ward and accessing the patient list, the list will be all the patients on that ward at that time, as long as the PAS system is up to date. You can access other patients on other wards using the wards list tab. Okay, so you highlight your patient and you press the prescribing, and that will take you straight to the drug chart. Okay, if you were to uh, press the prescribing and without using the list, you can search by NHS number. It's not something we recommend because it brings up all the patient's episodes of care. Okay. If they've got outpatients episodes open, etc. If you prescribe in the wrong episode, nurses will not be able to see it on the ward. Other prescribers won't be able to see it, and you will have to re-prescribe it. Okay. So please access the patients through the relevant ward list. Okay. So choose my patient, going to go to the prescribing tab, blank drug chart, all the patient demographics across the top, patient weight, top right-hand corner, allergies. Two things that need completed before you begin prescribing, allergies and VTE. If you attempted to prescribe before they were complete, it will prompt you. They can be overridden in an emergency situation. However, they will keep flagging up they need completing every time a prescriber logs on to the patient. Okay, so please complete the allergies and the VTE. To complete the allergies, you would hit on the change button. Allergies carry forward from episode to episode. So it's been recorded in the past that this patient has an allergy to clarithromycin. The little cross on the left will tell you what detail has been added by which user and when that was from. If you need to add, you've got the add button. You can highlight the reaction and you can cancel it. You can view more detail. You can amend it, whatever. Okay. In this case, we're happy that the patient only has the one allergy. We don't need to add anything. So we're hitting yes, that's fine. And that will confirm the allergies. VTE brings up the VTE form. For this demonstration, I'm going to say the patient is not expected to have reduced mobility. So therefore prophylaxis is not advised or required. And see if that completes the VTE. The VTE is generated when the patient is admitted to hospital. 24 hours later, be a second VTE, and that will highlight that that needs completed. Going to show you how to prescribe a few things that sometimes can cause a little bit of confusion, or just to demonstrate a few different scenarios. So new prescription button. Here is your favorites list, and this generates automatically based on your prescribing trends. So if you specialize in respiratory, you'll find you'll have a lot of NEBs here, things like that. Yeah, that's your sort of your favorite list, and it will amend and adjust itself based on what you prescribe. Okay. Up here, you can type in some letters of what you need and hit search, and that will bring up all the templates that have that letter combination. So in this case, I'm looking for some omeprazole, and it adds it to your order selected, which is a bit like a shopping basket. You can add more than one prescription at a time. See, the order select changes to 2, but I would be wary of doing more than 5 or 6, really. I have had an occasion where it has timed out on users when they've got 10 or 12 and they have to start again. So don't go too mad. I've added my 3 prescriptions that I want. So, okay. And at this point, you can amend anything you wish to. Okay, so you can click onto each one, and I'm going to change that to twice a day, for example. I'll change that to 10. So you can amend anything you wish to. You can also add any notes. You can change start times. You can add a course. Okay. Any additional directions you want on the prescription. Once you're happy, if you hit the back button, then you can access the other prescriptions that you've added. If you're happy with what you've done, you can hit send, and you will be presented with decision support. So this case, omeprazole and clopidogrel don't really go together. So the warning has pulled from the BNF. So different warnings that you will see are allergy warnings if the patient has any allergies recorded and there's any interaction, therapeutic duplication, and drug-to-drug interactions. Okay. You can continue. There's no hard stops in the system, but you do so at your professional discretion. Everything is audited or auditable in the system, so it will record that any warnings you have chosen to continue past. Okay. So in this case, I'm going to hit no. I'm not going to add that omeprazole. I can highlight it. I can remove it and add what's left. And that's it on the drug chart. Okay. And because we didn't add the omeprazole, add some lansoprazole. That goes better with clopidogrel. And because we're recording this now at just after 2 o'clock, so it's a morning dose. So that next dose will be tomorrow morning. If you needed a dose for today, you can enter immediate single dose by using that. And that will add a dose for now and then continue with this prescription from tomorrow. So the immediate single dose is really useful if you're prescribing after the due time. Okay, so it's just something to be aware of. You get your single dose and then your regular prescription starting tomorrow. I want to show you a few other different types of prescription. So antibiotics. All antibiotics are built with a mandatory treatment reason that needs completing. These have been populated with help from microbiology, so they're all micro-approved. So complete the reason for prescribing. It's a mandatory field. And oral antibiotics also have a mandatory length of course. IV antibiotics come with an inbuilt 48-hour review. Sound. And that will continue for 7 days, and you can see there's no dose due down here. Okay. We do have oxygen on the system. So I'll just show you what that looks like. They are built as PRN templates and continuous templates. There's different flow rates, there's different administration devices, so you can choose whichever one's appropriate. We also have warfarin on the system, which is something I want to show you. Warfarin is the only drug in the system that the prescriber has to do 2 actions for. So it's something I want you to be aware of. So we're going warfarin, 0.5 to 10. In the case of this demonstration, I will bypass this. There is a link here to the warfarin guidelines that you can access. You can see you get two warnings, and you have to acknowledge them twice. So you do get plenty of opportunity to consider if it's the correct course of action. This little triangle here shows that warnings have been overridden. You can always click on that to see who overrode them and what the warning was. Okay. We have a warfarin dosing desktop here, and that's because the warfarin is set from 0.5 to 10. So the nurse will need to know what dose to give on any given time. So to complete that, you hit on the INR report button, and here's one I've already completed. So today's date, INR of 2, dose of 2, what the action was, any comments if you need to, and the next due dose of next due date of an INR. Okay, so the nurse will give a 2 milligram dose from this date to this date. So if a nurse needs to know the dose, it's not recorded, but it is prescribed, it'll be this bit here that the prescriber needs to complete. Okay. A few other things to make life a little bit easier. Up here we have fluids task picker, and that is all the different fluids all separated into folders. So you've got your glucose, sodium chloride, etc. And you can pick whichever template you need. Probably one of the most common, 1 liter single dose. And it just needs how many hours you wish that bag to go over. We've also got supplementary paper charts. So not everything is on ePMA. There's certain drugs or treatments that aren't there, they remain on paper. So what we've done is we asked prescribers to signpost the nurse to that paper prescription. Do that by adding it to the drug chart. So in this case, we'll use vancomycin. Again, you've also got links to vancomycin guidelines. And if we go to the drug chart, you'll be able to see vancomycin pointing the nurse or any other prescriber that there's a paper chart, and we've got the fluids. An easy way to add another bag of fluids, if it's the same, you can copy that prescription. So if you tick on the box, this little drop down opens up and you've got a copy button. This is probably most handy for fluids. You could change the volume at this point or duration. But if you wish to do the same again, just hit send and that will add another bag of fluids on. So that's the quickest way to add another bag of fluids if it's the same bag. Okay. I want to show you how to suspend and amend. So there's a tick box here, same one we ticked to copy the fluids, tick that. That opens up your amend, discontinue and suspend. So discontinue is obviously stop, but if we want to suspend, we go to suspend. And you've got different actions here. So we'll suspend immediately. We'll leave it until it's manually unsuspended. You can't do it until a certain date in the future or a number of doses. A reason why, and hit OK. And that will suspend the simvastatin. So no doses can be administered until this is unsuspended. So the correct process to unsuspend this is not to prescribe simvastatin again. It's to tick this, go to suspend, and mark it as unsuspended. And the button is do not suspend. So it's to take the suspension off. That will open up the prescription again, and the next dose will be due for the nurse to administer. Okay. You can also amend at this point. So tick on the box would be amend. What we ask you to do for in terms of amending is to use this for change of dose or for change of frequency. But if you need to change something from an IV to an oral or an oral to IV, we ask that you stop the oral and re-prescribe as an IV. Okay, it is a new prescription. Please don't amend an oral to an IV or an IV to an oral. It doesn't work very well and it causes problems for pharmacy supply. Okay. So you can see we discontinued. When we amended, it discontinues that line and adds a new line. Another useful thing for prescribers is order sets. It's under the new prescription button. You can look for things like sodium epoxide, and it's got the moderate withdrawal regime and the severe withdrawal regime. And that will populate the chart with a reducing dose and also a when required. Okay. So if you see something like this, that's an order set, that will make your life a lot easier. There is also anyone for any respiratory patients might need a MART regime. So there's all the MART regimes. And if you're treating a patient for sepsis, there's all the sepsis bundles. Okay, so make yourself familiar. There's the amber, red, and depending on allergy status, which one's the most appropriate. Some of them have a couple of different antibiotics in, and that will populate on the chart. So make yourself familiar with the order sets. They will make your life a lot easier. Just another couple of things that prescribers quite find useful. Compact view squashes everything up. You can see a lot more at once. Not as useful for nurses. They can't administer from this page, but for prescribers, it's useful. Just take that off. And there's include, discontinued, and expired. So after anything has been completed, a length course of treatment, or a bag of fluids, or something's being discontinued, it will stay on the drug chart for 24 hours. After that, it will drop into the history of the prescription. So if you need to see that again, include discontinued and expired, and it will add it to the bottom of the drug chart. And there isn't any on this because it's a test patient and it's a new episode, but it will appear here. It'll be all grayed out. It'll be quite clear that it's been discontinued or completed. There'll be no administration, but that's how to see course of antibiotics, course of steroids, dose changes, bags of fluids, etc. So you include discontinued and expired. I think that's all I wanted to show you. So just some quick hints and tips. Please make yourself familiar with the internet page. There is links on some of the medications to point you towards the trust guidelines. Please make yourself familiar and yeah, have fun.